Some patients come to me with desperate eyes and say, "Doc, if this keeps up, I'd rather lose a toe than go through another gout attack." It sounds extreme, but anyone who's spent a sleepless night with a swollen, red-hot, burning toe knows exactly what they mean. Gout doesn't just attack your joints, it hits your sleep, your work, and even your joy for life. The question I hear most often from middle-aged and older patients in my clinic is, "Dr. James, can gout be completely cured?" Hello, everyone. I'm Dr. James from JointWise Health, where we help middle-aged and older adults better understand joint health and how to care for their bodies to live happier and healthier every day. If you find today's information helpful, don't forget to hit like and subscribe to join us on this journey to overcome gout and other joint issues. To answer that question, let me tell you about Mr. John, a 62-year-old from Texas. He used to be a mechanic, with skilled hands and strong legs that let him stand for hours by machines. But 7 years ago, gout knocked on his door, and it wasn't just a one-time visit. At first, he thought a few painkillers would do the trick. But every year, the gout attacks came back, more frequent, more intense. His ankle, knee, and especially his right big toe became a battleground. One day, sitting in my office, he frowned and asked, "Dr. James, is there a way to cure this for good? Or am I stuck with it for life?" I know that question hits home for many of you watching this. When people hear cure, they imagine erasing the disease like it never happened. But with gout, modern medicine offers a straightforward yet hopeful truth. We can't yet erase gout as if it never existed, but we can control it to the point where you almost forget you ever had it. What does that mean? Gout is caused by a buildup of uric acid in your blood, more than your body can flush out. These uric acid crystals settle in your joints, causing inflammation, swelling, and pain. Modern medicine can't completely change the biological mechanisms that cause your body to produce too much uric acid or excrete too little. But with the right combination of long-term medication, dietary adjustments, and lifestyle changes, we can keep uric acid levels stable and prevent gout attacks for years. For many of my patients, after following the right plan, they've gone 5 to 10 years without a flare-up. In fact, some say, "Doc, it feels like gout never came back." That's what I want you to understand. Curing gout, in medical terms, means controlling it so it no longer disrupts your life. Many people, like Mr. John, once thought gout was a life sentence because they were stuck in a familiar cycle. 1. A flare-up hits, they take painkillers for a few days, the pain goes away. 2. They go back to their old eating habits. 3. Sometime later the pain returns, often worse than before. This cycle leaves people feeling helpless, like gout is running their lives. But the truth is, it's not that gout is unstoppable, it's that we haven't been managing it the right way. I often explain to patients, if you only focus on putting out the pain without addressing the root cause, high uric acid levels, gout will always come back. It's like mopping up water on the floor without turning off the leaky faucet. You can clean it up each time, but the water will keep spilling. When Mr. John understood this, he started making changes. He took long-term medication to lower and maintain safe uric acid levels. He adjusted some eating and lifestyle habits, which I'll cover in detail in another video about nutrition. After just 8 months, he realized he hadn't had a single gout attack since starting the new plan. So, if we can't erase gout but can put it into hibernation for years, what determines success? Stick with me, and we'll dive deeper into how modern medicine really controls gout and how your 60s and 70s can be free from those agonizing nighttime attacks. When we talk about putting gout into hibernation for years, it's not about luck or some miracle pill. It's the result of a comprehensive treatment strategy, built on decades of medical experience and thousands of clinical studies. To illustrate, let's go back to Mr. John's story. Once he understood that the goal wasn't an absolute cure but long-term control, he agreed to start a tailored treatment plan. This plan had 3 core pillars, the same principles anyone with gout needs to know. Pillar 1, keep uric acid levels below the danger zone. Think of uric acid like water in a glass. If the water stays below a certain level, everything's fine. But when it overflows, that's when uric acid crystals form in your joints, triggering a gout attack. Our goal is to keep the water level low enough that crystals don't form. According to the American College of Rheumatology, ACR, the ideal uric acid level to prevent flare-ups is below 6 mg per deciliter, and for people with TOFI, uric acid crystal deposits under the skin, it should be below 5 mg per deciliter. This requires regular monitoring, not just a one-time test. For Mr. John, we checked his levels every 2 to 3 months until they stabilized, then every 6 months. When uric acid stays at a safe level for months, the risk of new attacks drops sharply, and existing crystals start to dissolve. Some of my patients are skeptical at first. "Doc, I'm not in pain right now, why do I need daily meds?" But gout isn't like the flu, it progresses silently, even when you don't feel pain. Keeping uric acid low is like turning off the leaky faucet I mentioned earlier. Pillar 2, use uric acid lowering medications correctly and consistently. One of the most common mistakes I see is patients stopping their meds too soon or adjusting the dose on their own. That's almost a guarantee the gout will come back. There are 2 main types of long-term medications. Drugs that reduce uric acid production, like allopurinol or febuxostat. Drugs that increase uric acid excretion, like probenecid. For Mr. John, we chose allopurinol, starting with a low dose to avoid triggering a flare, then gradually increasing to the right maintenance dose. It took a few months, but his uric acid dropped from 8.5 mg per deciliter to 5.2 mg per deciliter and stayed there. A key point, uric acid lowering meds aren't like painkillers. You don't just take them during an attack, they're taken daily to prevent attacks from happening. I tell my patients, these meds are like a seatbelt in a car, you don't just buckle up when you see a crash coming, you wear it the whole ride. Pillar 3, prevent flares when starting treatment. Here's something that surprises many, when you first start lowering uric acid, gout attacks can actually increase in the first few months. It sounds counterintuitive, but it's a natural response as old uric acid crystals dissolve, releasing tiny fragments that cause inflammation. To prevent this, we often prescribe low-dose anti-inflammatory drugs like colchicine or NSAIDs during the early phase. For Mr. John, this kept him from getting discouraged when flares popped up in the first few months. After 6 months, as the old crystals dissolved and his uric acid stabilized, the risk of flares dropped, and he could stop the preventive meds. By following these 3 pillars, Mr. John not only avoided gout attacks for over a year but also realized something profound: he wasn't afraid to sleep anymore. He once told me, "Doc, I used to dread going to bed, not knowing if the pain would wake me up at 3 a.m. Now, he could sleep soundly and wake up with pain-free feet. I know taking a daily pill might sound like a hassle. But trust me, this isn't just about treating a disease, it's about investing in years free from gout's grip. If you've ever thought gout was a life sentence, I want you to believe this: with the right strategy, you can turn it into a quiet neighbor that doesn't bother you. So, beyond meds and uric acid control, what else in modern medicine helps keep gout under control for the long haul? I'll share the factors that people often overlook but have the power to prevent gout from coming back, even in your 70s or 80s. After a year without a gout attack, Mr. John started to trust the treatment plan. But at 62, he knew he still had a long road ahead. That's when we discuss strategies to keep gout asleep for the long term, not just 1 or 2 years, but potentially a decade or more. I want to share the factors that modern medicine considers the second layer of protection in gout treatment. These don't replace medication but, when done right, make the treatment far more effective. Factor 1. Regular monitoring, like an appointment with yourself. One reason gout sneaks back is that patients stop checking their blood levels once they feel fine. They think, "I'm okay now, everything must be good." But gout can quietly build up before you feel it. With Mr. John, we scheduled uric acid tests and joint health checks every 6 months. We also looked for tophi, those crystal deposits under the skin. Catching them early lets us adjust treatment before they cause permanent joint damage. I call this an appointment with your future. Each checkup is a chance to ensure gout doesn't steal your years ahead. Factor 2. Adjusting meds as your body changes. Your body at 65 isn't the same as it was at 60. Kidney function, weight, and other conditions like diabetes or high blood pressure all affect how your body handles uric acid in medications. For example, after 3 years, Mr. John lost weight and improved his heart health. His blood tests showed his uric acid was consistently lower, so we reduced his allopurinol dose just enough to stay safe while minimizing side effects. The lesson? Gout treatment isn't a one-size-fits-all, lifelong prescription. It needs tweaks as your health evolves. Factor 3. Managing coexisting conditions. Here's something many don't realize. Conditions like kidney disease, high blood pressure, diabetes, or obesity don't just affect overall health, they make gout harder to control. Weak kidneys, less uric acid excretion. High blood pressure or heart disease limits the medications you can use for gout. Obesity increases uric acid production. For Mr. John, keeping his blood pressure stable didn't just help his heart, it made his gout meds work better. When treating gout, remember your body is a system. Every part impacts the gout battlefield. Factor 4. Avoiding the no pain, no problem trap. I've had patients call me, embarrassed and confused, saying, "Dr. James, I stopped my meds 4 months ago because I felt fine, and now the gout's back." This is a common trap. When the pain stops, your brain assumes the disease is gone. But gout is a silent neighbor. If you don't keep up the barriers, it'll sneak back in. Mr. John had this mindset at first, but I reminded him, treating gout is like maintaining a bridge. You don't wait for it to collapse before fixing it, you maintain it regularly so it never does. Factor 5. Your role in treatment decisions. Modern medicine emphasizes patients being active partners in their care. You're not just receiving a prescription, you're a teammate. You monitor your body and report changes to your doctor. You understand your treatment goals and know your target uric acid level. You ask questions instead of guessing. For Mr. John, we created a personal treatment plan with clear goals, test schedules, medications, and things to watch for. This helped him feel in control of his gout, not the other way around. You might think, that's a lot to keep track of. But trust me, after a few months, it becomes second nature, like wearing sunglasses in bright light or buckling your seatbelt. Mr. John barely thinks about gout daily anymore. He takes his meds, gets his checkups, and spends the rest of his time tending his tomato garden and playing with his grandkids. That's what matters most. Gout is no longer the center of his life. So, once gout is under control long-term, what keeps it that way into your 70s, 80s, and beyond? In the next part, I'll share the final factors and the most important message for everyone fighting gout. When I saw Mr. John after nearly 5 years of treatment, he walked into my office with a grin so big I barely recognized the tired, frustrated man from before. He shook my hand and said, "Dr. James, I can walk 2 miles every morning without a hint of pain." Honestly, gout feels like a distant memory. Hearing that, I knew it wasn't just luck. Mr. John achieved what many patients can, keeping gout asleep 4 years through modern medical treatment and his own persistence. Today, I want to share the final factors that make this a lasting part of your life. Factor 6. Maintain safe, consistent physical activity. You might think exercise is just for lifestyle and prevention, but it's critical for gout treatment and prevention. Proper movement improves blood flow, helping your body process uric acid more efficiently. Stronger muscles and joints, less stress on joints previously hit by gout. For Mr. John, we didn't push intense workouts. He started with 15-minute light walks daily, building up to 30 to 40 minutes. On days when his joints felt stiff, he switched to gentle swimming or stationary cycling. The key: avoid high-impact activities like long-distance running or jumping, which can stress joints previously affected by gout. Factor 7. Identify and avoid personal triggers. Even with meds and stable uric acid, certain things can spark a gout flare in sensitive people. These vary from person to person, so you need to observe your body. For Mr. John, he noticed that even 1 to 2 beers made his joints feel tight the next day. He cut them out entirely. But a little red meat at Thanksgiving dinner didn't bother him, as long as he didn't overdo it for days. My advice: keep a personal journal of what you eat, drink, and do when you notice symptoms. After a few months, you'll spot your unique triggers. Factor 8. Have a plan for if gout returns. Nobody wants to talk about this, but as a doctor, I know that even if you do everything right, gout can come back, especially with new factors like injuries, other illnesses, or medication changes. That's why I prepare patients with a response plan. Keep anti-inflammatory meds or colchicine at home with clear dosage instructions. Contact your doctor early instead of waiting days to see if it goes away. Adjust your routine temporarily to ease stress on the affected joint. With this plan, if a flare happens, you can shut it down quickly, minimizing pain and duration. Factor 9. Stay positive and proactive. It might not sound medical, but your mindset directly impacts treatment adherence. Studies show patients who believe they can control gout stick to their meds and plans far better than those who feel defeated. Mr. John once said, "Dr. James, I don't feel like gout's victim anymore. I'm the one in charge." That shift, from passive to proactive, was his biggest change. If you're watching this and wondering, can I live without gout ruining my life a few times a year? The answer is yes. Not through magic, but through proper modern medical treatment, regular monitoring, avoiding personal triggers, and, above all, your own persistence. Gout may not disappear from your body entirely, but it can disappear from your daily life. If today's insights helped you understand gout better and gave you hope to control it, please hit like to share this video with others who need it. Subscribe to JointWise Health for more videos on treating and preventing gout and other joint issues. And if you have a story or tip for dealing with gout, drop it in the comments. Your experience might inspire someone else. I'm Dr. James, wishing you mornings with light, pain-free feet and a spirit ready to embrace life, whether you're 40, 60, or 80. Remember, healthy joints are the key to unlocking vibrant years ahead.